Are you perimenopausal or menopausal women from 35 years old? Yes, it starts sometimes at 35, all the way to 50 plus women over. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. Join me and my friend Kathy, and I'll be demonstrating my top 5 compound movements to help strengthen your bones, your muscles safely and effectively. If you have weak pelvic floor muscles, yep, it gets weak as we get older, as we age. It goes down to a prolapse, and you want to be safe and effective with proper breathwork to strengthen your deep core muscles. So get your mat ready, and today get a kettlebell, dumbbells, or big jug of water to join me and Kathy today. Okay, my friends, let's warm up our deep core muscles first. As you breathe in, try to push your belly out, Kathy, and try not to breathe lifting your shoulders up. And then, there you go. See, she's lifting her shoulders up a little bit, so I want that to be depressed down. When you lift up and then core engage, try not to hyperextend your spine. So, there you go. So when you breathe like this, you're gonna have neck pain, and you wanna make sure you're depressing your shoulders down and inhale. Laterally expand your ribcage and zip it up from your lower abs as you breathe out to your navel and breathe out through your mouth. So inhale. See, she's lifting her shoulders again. Again, inhale. That's still lifting. So feel it on your lateral ribcage, expand through the side. You're trying to push your belly out. Sometimes I like that cueing to expand your belly. There you go. And then zip it up from your lower abs and up. That's very crucial and important, because if you don't do that, you're gonna press down to your pelvic floor, and that causes prolapse when you lift heavy. Again, inhale. So warming up the engine, our powerhouse of the body. Zip it up. Imagining zipping up a tight jean. Imagine that, Kathy. This is her first time proper breath work. Inhale, and then breathe out through your mouth. And zip it up. Inhale, and then you zip it up as you breathe out. So let me open here. Let's imagine the zipping of the jean. Breathe out. It's nice, right? Did you feel that inside? And then you can add Kegels. Kegels is imagining not to pee. Okay. When you do that, you're engaging your bladder. Let's try it again. One more time, my friends. Inhale. Exhale, zip it up. Last one. Exhale. See, it feels so good to warm up. Right now, you feel some cramping inside, right? And now let's warm up first with a lovely plie. Plie is when you lower your hips down, pushing your knee out, core engage. I don't want the buttocks sticking out. I want that in as you go down. Toes pointing out to the side. Open those hip external rotators to activate your pelvic floor. Tilt in a little bit as you inhale. Zip it up as you extend your legs, standing straight without hyperextending your spine. I don't want arching. I want that neutral spine position. Again, inhale down. Tilt your pelvic in. Zip it up. Exhale. 8 more. Breathe in. Breathe out. 7. So far, so good, Kathy? Good. It feels good on the hips, right? 5 more. 4. Go down as much as you can. If you need the countertop for support to keep your balance, that would be great. 2. Last one, my friends, and 1. So after warming up, now let's warm up your toes and ankles. Without the strength of your toes and ankles, that's not going to be helpful when you run and walk and jump if you have weak toes and ankles. The pressure goes to your pelvic floor. So let's begin now. Plie down. And then keep your back straight a little bit. Pelvic curl in. Good job, Kathy. And then lift one heel up to strengthen. And then down, and then switch. We'll do 10 times, 9 more. Hold that position. As I said, if you're very weak, hold on into a countertop. Feel the burn on your quads, right? 6 more. With your breathing, core engage, curl in, protect your pelvic floor. 4, 3, 2, and 1. And then slowly extend, shake it off. Feels so good, right? And now we're gonna wake up those pelvic floor by swinging your body left and right. Let's warm up our body. Feels good, right? Stretch it off. Breathe in and breathe out. 8 more. Swing your body gently. Feel the rhythm with your breath work. 5, 4, 3, 2, and 1. Well done. Now we're gonna pick up the kettlebell. I have a 10-pound kettlebell. She has some 8 pounds. You can start light for absolute beginners. Slowly build strength. Okay, my friends? Now, as we play down and pick up the dumbbell, we're gonna do some sumo squats. So lower your hips down, grab the kettlebell, keep your core engaged. Inhale. As you extend, breathe out. And then place the kettlebell on your chest and overhead press. And then lower it down to your chest. And then slowly lower it down to the floor as you plie all the way down. Inhale. Exhale, zip it up. Extend your legs. Place it on your chest and then overhead. Back to your chest. And then plie. Down. 7 more. Press up as you breathe out. Squeeze your core in. Inhale as you go down. Breathe out as you extend and then overhead. Inhale as you go down. So far, so good, Kathy. Feels good, right? And then as you press up, it's nice to slightly look up to engage your neck muscles. 4 more, my friends. Inhale down. Warming up those hips. There could be ticks and clicks on your knees. As long as there's no pain. That's my knee clicking right now. I had a knee injury many years ago. Meniscal tear, but it's okay as long as I build strength and there's no pain. Last one. Well done. The next exercise is lunges. So we're going to face towards the left. Place the kettlebell on your right hand. Keep your core engaged. And then when you do a lunge, as you lower your back knee down, you don't want to keep your pelvis not squared. Keep it squared, facing further, making sure they're level. So I'm checking Kathy, making sure she's straight. Zip it up, core engage. Beautiful. Can you feel that difference on the alignment, right? And then place the kettlebell a little bit closer to the front of your knee. And then as you lower, you lean forward a little bit. So my nose is over my knees a little bit. Nose over knees. As I lower my right knee down, lean forward more on your hinge on your hip. Inhale, exhale up. Balance. If you need a countertop, you can get some countertop for Kathy. So far, so good. That's why lightweight. I'd rather you learn proper form than pushing yourself to the point of falling, right? So inhale, exhale down. Inhale, exhale up. Just like 2 deep breaths. Breathe in, breathe out, down, and up. 7 more. 6, 5. Inhale, exhale down. 4. Feel the burn on your quads, right? And if you want your glutes a little bit more, lean forward. 3, 2, and 1. Well done. These lovely exercises will help prevent osteoporosis or osteopenia as we lose estrogen as we get older. We want to make sure we're building strength by doing strength training. Okay, my friends, let's switch to the other side. As I said, keep it squared, core engaged, tilt your pelvis in. Good. Bend, lower the back knee, kettlebell near the right knee in front of you. Lean forward, hinge a little bit for your right glutes. Exhale up. 9 more. 8, 7, 6, 5, 4. You might find one side weaker, right? And that's normal. 2 and 1. Well done. How are you feeling? Feels good? The next one is deadlift. Let's do it side position so you can see the hinging of my pelvis through your hips, not your back. So hip hinge is very important to strengthen your back, your glutes and hamstrings. Whatever your goal is. If your knees are a little bit softened and bent, then we're gonna target your glutes. So soften your knees. And then when you lower down gently in front of you, you're slowly pulling back. Someone's pulling your buttocks back and you're leaning towards your heel. Keeping your elbows soft like a spaghetti. Chin tuck. And then if you look up a little bit, that's your glutes. When you look down, that's more of your hamstrings. If your knees are straight, that's your hamstring. If it's bent, it's your glutes. So I want to target my glutes. Inhale, exhale up. Squeeze your glutes as you stand up, zip it up. Don't forget the pelvic floor health. Inhale. Exhale up. Feels good, right? You feel that lengthening? A lovely, right? Inhale. Exhale. I'm glad you're loving it, Kathy. 7. Look up for your glutes. So when you go down, you look up. 5 more. Feel mind-body connection on your buttocks. Really squeezing your glutes. 4, 3, 2, and 1. When you go up, Kathy, I don't want you to pull it up on your elbow like that, or else that's your biceps. You want it all hinging. So first, we did sumo squat. Second, we did lunges. Third, we did deadlift. We have 2 more exercises. But we also combined some overhead press. So that's already like a 4th exercise for upper body. But we are doing the top 5 compound. The next one is rows. So rowing is good for your upper back muscles. So you're gonna hinge again through your hips as much as you can. You wanna make sure your back all the way to your neck, they're aligned, and you don't wanna be hunched up on your upper back. Core engaged, zip it up. You start with your right hand. We're gonna isolate your right back muscle, upper back muscles. One hand on your knee for support if you like. Inhale, exhale, pull back. Squeezing your elbow. You wanna make sure your elbows are close to your back and lift. You don't wanna flare out, flare in. Pull it in and squeeze. And down. Inhale, exhale, pull. 2, 3. Feel the burn, right? 4, feels so good, right? 5, 6, exhale, zip it up. 7, 8, 9, last one, my friends. 10, well done. And shake it off. And let's switch to the other side. I'm turning my body this way so you can see my other arm. Hinge through your hips. Not like this, my ladies. Make sure you look at the mirrors. Make sure your posture is correct. Okay, with the kettlebell outside of your knee and your foot. Squeeze your core in, brace your core. One hand on top of your knee, my right hand, and I'm holding kettlebell on my left. Inhale, exhale, squeeze. And you might find one side weaker, and that's why it's nice to isolate one arm at a time. 4, 5, breathe out as you lift. 6, 7, 8, 9, last one, 10. Well done. How are you feeling, my girl?
Yeah, I'm good.
The last exercise, I know sumo squat is different because you're hip adductors. Now I want to do goblet squat. Goblet squat, place the kettlebell on your chest. This is the last exercise for today. And we're going to go all the way down to the floor for an Asian squat. If you can do Asian squat yet, which is going all the way down here because of tightness of your hips, Kathy is doing great. But make sure you're pushing your knee out. There you go. Open the pelvic floor muscles. I know, open it up. It's okay. It's functional. You want the pelvic floor to be functional. For intimacy, right? My ladies, it's okay to talk about it. Nothing to be ashamed of. It's functional for women, okay? And bladder control. Because that's why stress incontinence, urge incontinence, where these knees laugh and jump, they pee, because they're tight. It's not just weak. Now you know to be prepared if you want to have babies, okay, my friends? Okay, from this position, if you can do this, we're going to do tippy toes. Strengthen those toe muscles. 10, 9, breathe out. 8, 7, 6, 5, 4, 3, 2, and 1. And now we're going to go stand all the way up and breathe out and press up again. Military press to strengthen your shoulders. This is one of the best ways to keep your bones healthy, this exercise. Inhale, lower down to your chest, and then squat again. Exhale. Inhale, exhale, stand up and press up. All the way down now, my friends. 3 more. Oh no, 7 more. 6. Inhale, exhale, press up. Squeeze your core in as you press up. 5, 4, 3, 2, last one, and 1. Well done, my friends. We are cooling down now. How are you feeling, my girl?
Getting sweaty.
I'm glad you love it. It looks so simple for women, especially with perimenopause or menopausal. We don't want to increase too much cortisol. We don't want to just challenge your bones and muscles, but not to the point that you ended up storing fat on your belly because you're too stressed. Guess what? You are building muscle 3 days a week, 20 minutes workout. That's all you need to keep your muscles strong and bones, and then slowly progress for more weights. We just did 10 repetitions right now. Do another set, 2 to 3 sets if you have time today. We are cooling down now. We're just gonna do some stretches. Start in kneeling, lunge, stretch your hip flexors. We're gonna do some dynamic stretching, and then exhale. Stretch your hamstrings and lean forward for a lovely stretch on your back. Forward, hip flexors on your right, hamstrings on your left. 3 more. Inhale, exhale. 2. Last one, and 1. And now let's switch to the other side. Breathe in and lean forward. Exhale back. Inhale. Exhale. 3 more. You might find one side is tighter, right? This is my tighter side, my right side. My dominant side. Last one, my friends. And now we're gonna do some frog pose stretch. This is good for your hip adductors, knees out of the mat, feet together. Lower your hips down. Stretch to a lovely child pose with your knees out. And then in, look up, lift your hips up and look up to the ceiling. Stretch your low back, breathe in, breathe out, down. So far, so good. Inhale, exhale. 2 more. Last one. And the next one is we're gonna do some pigeon stretch. Place your knee between your hands, extend the other leg. So I'm starting with my right knee. As long as you have no hip pain, keeping your pelvis level, squared. And then forward fold. Feel that stretch in your glutes. It's deep, right? Exhale, look up. Inhale, down. Exhale, up. Last one. And then switch to the other side. Left knee, bend it. Pull the left foot near your hip groin area. With your hands pressed up as you look up. Inhale, exhale, down. Feel that lovely stretch in your glutes as you go down. And as you stretch up, hip flexor on your right. 2 more. Last one. Well done. Now we're gonna sit up in a mermaid position. 90 degrees on your knee, level your foot, and then your right knee level to your right hip. So for my lovely friend Kathy, she needs to pull it forward to 90 degrees on her knee. I know, see how you feel that on your hip, right? And that will help your hip flexors and hip abductors, internal rotators, plus your pelvic floor. Let's go back to pelvic floor health. Isn't that amazing? This is beautiful. And then twist. Feel the twist, right? And then twist. Breathe in and breathe out. Inhale, exhale. And now we're going to challenge by lifting your knee up. Open that tight hip, right? You feel that? And then lean forward and lift your back foot as you lean forward. And then up. So we're doing external rotation as you lift, internal rotation as you lean forward. To activate your tiny hip muscles that gets neglected. When we lift weights, we're just building bigger muscles. We don't want to neglect those smaller muscles that gets tight first and atrophy as we age. We want to be flexible, mobile, and agile as we get older. We want to show off to the young generations, hey, look at us. We don't feel that way, right? And it's nice to start no matter what age you are. Don't forget the cooling down properly. Let's switch to the other side. And then as you switch, you might find, hey, I'm tighter on the other side. And that's normal. And that's where you want to try to focus and build that flexibility and turn. See, it's easier on that side, right? So for Kathy, she has more problem on her left. Deep hip, internal external rotators. Now she knows what to do, right, Kathy? She will try her best now. Through movement, you find out, hey, I need to make this even, right? It's impossible to have a balanced body, but we can always make it better, right? There's no perfect balanced body because of lifestyle and hand dominance, but that's why we're here to find out, right? And now we're gonna lean back as you open that tight right hip. See, she could open more, right? And then lean forward and lift the back foot. Lift your back foot. There you go. And up. Inhale, exhale. Don't forget your breath work. 4 more, my friends. 3, 2, last one, and 1. Well done. Now we are almost done. We're in the last stretch of our program. How are you feeling, Kathy? It's amazing, right? Feet together, butterfly stretch. We're gonna start flying like butterflies. Keeping your back straight. And this is good for the pelvic floor. I'm preparing her body if she decides to have a baby. And that's okay. That's part of being a woman, right? Whatever your time and your age, season in life. And as a woman with more experience in life, who experienced pregnancies, babies, C-sections, postpartum, I'm here to guide any woman out there who needed my help and guidance. I'm so passionate about pelvic floor health, women's health. I share it all over the world, and I'm glad you're loving my series. And I can't wait for you to try my Revive Pelvic Floor Health Core Rehab that I'm going to be opening soon. Okay, my friends, let's do circles. I'll be opening it on March 30, and I have a new 7-day challenge in the beach with my cousins. You should check it out. If you want to join that upcoming new free 7-day series, click the link on my bio, on my description below. Write your name and email address, and you will receive the access to my 7-day amazing postpartum healing program. Even for perimenopausal or menopausal women, everyone will benefit from strength training, right? And then switch. It's a lot of cueings of proper breath work, core engagement like this one. I can't wait to share it to everyone. I put my heart and soul on my videos, and I even went to Destin, Florida for it, with the beautiful beach of Florida. You're gonna love it when you join the series. Okay, my friends, now lift your arms up overhead and bend forward for a lovely cool down for butterfly deep stretch. And we hold this in 3 deep. Last deep breath in. And that's it. I'm hoping you enjoyed my lovely Pilates top 5 compound movement that you can start doing right now to keep your bones, muscles strong and healthy for perimenopausal, menopausal women, especially women more than 35 to 50 years old and over. It's not too late to build strength. If you want to learn more about my Revive Pelvic Floor Health Core Rehab, click the link on the description below and join my upcoming new 7-day series that you can enjoy. If you have time today, check out my episode 1 about my core back immersion therapy. And I have an absolute beginner program for those who doesn't know how to start mobility flow, Pilates yoga. Check out my membership class. And thank you for my friend Kathy. Always remember, be safe, be well, and healthy you. Bye.